Hi, my name's Jenny Sprung. My website is treatyourselfnaturally.com. I am a neurosomatic massage therapist. I do all the somatic work, all the muscles, the attachments, the tendons, the ligaments, but I also do all of the neuro work, which is the viscera, the atlas axis, the jaw, the eyes, the nose. I want to review today with you the neck. The neck is one of the hardest muscles, areas to work yourself. My website, treatyourselfnaturally.com, is a resource guide for you to do it yourself to reduce pain, increase range of motion, address painful trigger points, release fascia. We're going to talk about the neck today. So if you use computer a lot, if you use handhelds a lot, then you suffer from a head forward position, and that's no good for you. Reduce all of the usage of computer and handhelds as much as you can. I know, right? Check out my website, but don't use a computer. Try to reduce your computer use. Set a timer, be careful. Do some stretches and exercises and do these simple manual manipulation techniques to release the anterior and posterior neck. And definitely get some good neurosomatic massage therapy, some good zero balancing, some excellent alternative methods, acupuncture, anything. Make sure you have a duo or a triage of health practitioners, efficient, effective, knowledgeable people that can help you. So for the neck, the first thing I'd like you to do are the 8 stretches. So Egyptian would be forward and back, bobblehead would be side to side. You can look down and you can look up a little bit, don't overdo that. You can turn left and turn right. You can do ear to shoulder and the other side. And then you can pour your head over, and that feels so good, and pour your head over. Roll the shoulders back and roll the shoulders forward. Excellent. You want to make sure that you check out my temporomandibular joint dysfunction do-it-yourself video, as well as visceral video, as well as head and cranium and eyes. They're all very much related. So superficial anterior neck, platysma. You're going to grab the skin and roll it all the way down to your collarbone, both sides. Any way you can. Sideways, up and down, whatever you can. Pull the fascia, pull, and open it up from the mandible, the jawbone, down to the clavicle, the collarbone. Great. And then you can do your superficial anterior cervical muscles by just placing a finger under your jawbone, moving your jaw a little bit, and coming up. When you find a tight sore spot, go into it and just squeeze it and pull the fascia, gather the fascia, warm the fascia, open that up. You can move your hyoid. You'll feel some crunchies. It's safe to do, keeping that soft and moving that. The next 2 muscles I would like you to seriously consider lying down to do this work so that you can relax your shoulders, your arms, and your head and neck. But for purposes of clarification, I'd like to show you seated. Also ask that you go to my website. There's an article accompanying this video that gives you locations of the structures and where you can find them. Sternocleidomastoid. So sternum, clavicular, cleido, mastoid. the mastoid is here. This is a very large model of the cranium. We're going to be working all of the posterior neck and the anterior neck, gently, superficial. So the first point for sternocleidomastoid is to turn your head to the left. Reach your right hand across, and you're going to find what I call is a sit-up muscle. It's that muscle that strains when you do sit-ups inappropriately, improperly. And you're going to find the SCM, and you're going to simply grab it and roll it between your fingers and your thumb. Just like that, very gentle, 2, 3, and maybe 4 pounds of pressure. Nothing at all. Inhale, exhale. If you feel faint, you're in the wrong place, get out of there. See if you can find this muscle. You want to shorten it, bend the head over to the left, and then reach the right hand across and just gather, just like this. You can also reach the left hand and gather. You can do little shakes, little pinches. You can go all the way up to the mastoid process. And again, that's here. That's where that muscle attaches. Okay? This is huge. You can feel this refer back around behind the ear, behind the eye. If you can keep this muscle soft, you can reduce tight, contracted areas. So the right side, I'm going to bend over to the right to shorten and soften the muscle. And you should be able to see how I can grab that right there. Again, very light. Just finding this muscle and grabbing it. You're way off to the side. You're behind the ear. Way off. Way away from any endangerment. And then see if you can grab a big piece of it. Sternocleidomastoid is actually 2 muscles and they twist. They're really magnificent, beautiful muscles. So work that. And if you have any questions, contact me on my contact page. I'm available for consult. I'm available for treatment. I would like you to be able to work this. And then the scalenes, the muscles that attach underneath the clavicle, you can just run your hands across the clavicle and down into the manubrium and scoop in there. So across the clavicle and down into the manubrium and scoop in there. Again, across the clavicle, down in the manubrium and scoop in there and here. You can even spread out your sternum. Spread it out. And this will open up the muscles that associate and are neighbors to the anterior neck. And we have a shoulder video, show you how to work all of the shoulder on foam roller. And most of the videos right now are at beginner, because I'd like us to start off slow and safely, and then we'll move on to intermediate and advanced together. So scalenes, and then you can just rake down across the anterior neck. Very important. You'll feel in here, right at the clavicle, right at the collarbone. You can drop the chin and just roll right on that collarbone right there. And oftentimes you'll feel one is more forward than the other or higher. Just give a little hold in that area and do some of the neck exercises. Touch that bone. Nice big breaths. The inhale is 2 to 4 counts. The exhale is twice as long, 4 to 8 counts. Never holding anything too long in the anterior neck. Just rolling, connecting, getting to know that space. Now for the posterior neck, I'd like you to consider using one of my T-bars. You can get the resources for this on my website. I will turn to the side here, keeping the T-bars near, and I'd like you to work your suboccipitals. So they are going to be right underneath the occiput, right here. You're just going to run your hand or a soft tool gently across the fascia in there. Really juicy, really yummy. You can even pull across. So my left hand's pulling across the base of my skull, and my right hand's pulling back along the vertebra. So it's here. All of this is excellent for you. And of course you're going to do the other side, and you can do that this way here. This is just to release the fascia. And see, I do a lot of body work, a lot of treatment. So I have a sore spot in my neck right here, and I feel this a lot on folks. And just spread it out. If it's too sore, get out of there. Let a professional do the work. But if you feel comfortable, empower yourself to connect with your posterior neck, your anterior neck. You can hold on to the atlas or the axis with each finger and just move the head. So all of these 8 neck movements can be done while you're pulling and working the fascia. The trapezius attaches right behind the ears. You'll feel a little dent, and it will be tender. So go easy. Breathe deep, but find that tender spot. Here you can use a beveled edge tool and just rake across it or rock on it. So it's going to be more of a rocking sensation in the occiput and in the neck. If you can't afford these, they're not that expensive, but you can use the eraser side of a pencil or your fingers. You may have a soft massage tool at home that works. And you're just going to rock it and move. And of course do the other side, but for purposes of the video, I just want to show you where I am. So again, we're all through here, just underneath the base of the skull. And then you can go down and rub into the vertebral wings, between the vertebral wings and the sinus and the spinous processes. All in here. It just feels good. Very light pressure, very gentle, very easy. Just saying hello. Moving the fascia, warming things up. Now if you get a spot that's real tender, you may feel it referring to the head. Pay attention. If it reduces, breathe into it and let it release. 8 to 12 seconds. Nothing should get worse. Anytime something feels not quite right, you're in charge, you know what to do. Get out of there. But this should be yummy. This is so yummy, so good. So important to do. I do my neck all the time, and you can do it seated. You can do it lying down, so you don't have to do so much work holding your arms up. But any of this is very good for you. Nice big breath, big release. I can feel the fascia softening. It's wonderful. Thank you very much. Please come and visit the website, and I appreciate very much. Hope anything and everything works for you, your family, and your friends. Goodbye.